Hello, my name is Andrea Zamudio. I will be discussing the introduction about Alzheimer's disease and the development of it. Alzheimer's disease is known to be a worldwide struggle. This brain disease eliminates memorization, the ability to think, and do simply daily life tasks. The main cause of Alzheimer's disease is a certain protein called beta amyloid 42. Too much of this protein can be toxic to the brain. The overabundance of the protein clumps together to form plaques that collect between neurons and disrupt cell function. We require healthy neurons to keep our brain vigorous in order to maintain our body. We have thousands of neurons in our brain, and these neurons perpetually communicate with each other through electrical charges that penetrate down axons, causing the relinquishment of chemicals to other neurons. While all these neurons are communicating, both astrocyte and microglia keep away unwanted things in order to keep the neurons healthy. When a person has Alzheimer's disease, it causes the brain to change, destroying the healthy balance astrocyte and microglia are trying to keep. These changes can take years or even decades to finally see the first signs of dementia. This work was informed by National Institute of Aging, NIA, What is Alzheimer's Disease, National Institute of Aging, US Department of Health and Human Services. This is the main reason why a person with Alzheimer's disease begins to lose who they are and become unrecognizable to themselves and others around them. I'll be discussing a woman who was diagnosed with Alzheimer's disease. She is now 81 years of age and started development of symptoms of dementia at the age of 71. For those 10 years, the disease prolonged and gradually hit the final stages of advanced Alzheimer's disease. She was then placed in hospice care where they only take in patients with a life of expectancy of 6 months or less. She was nonverbal and would also refuse to take any of her medications. And also, she was very stubborn to get out of her wheelchair for months. This work was informed by Cutler Jeremy M. ETAL, Treatment of Alzheimer's Disease with CT Scans, Dose Response Volume 14.
Hello, my name is Brianna Ramirez, and I'm going to be discussing the symptoms our 81-year-old patient was experiencing. By this time, our patient's disease had advanced to the final stages, leading her to live in hospice care, where most Alzheimer's patients go when their life expectancy is that of less than 6 months. A little over a month, our patient had become completely non-responsive, and previous to this moment, she had frequently refused medication, she had become non-communicative, where she would barely say a word, and she had become immobile. These symptoms can typically be brought on by an abundant amount of neuronal damage that's going to disrupt the communication between the neurons, which will eventually result in loss of function and cell death. In a person that is diagnosed with Alzheimer's disease, damage is widespread, as many of the neurons in the brain stop functioning, they lose their connections with other neurons, and eventually die. This disease disrupts neuron processes that are vital to the network, which includes communication, metabolism, and repair. In the beginning stages, this disease typically destroys neurons and their connections in parts of the brain involved in memory. This includes the entorhinal cortex and hippocampus. As stated by Swerdlow in a 2007 report, more recently recognized histopathological features include synaptic degeneration, hippocampal neuronal loss, and aneuploidy. This disease then goes on to affect areas that are found in the cerebral cortex responsible for language, reasoning, and social behavior. After a certain amount of time, an individual loses their ability to live independently, which can be fatal. Alzheimer's disease contains many molecular changes in the brain during the development of deterioration. As stated by Andrea earlier, beta amyloid protein is a specific protein that is going to be found in this disease. It comes in many different molecular forms that collect between neurons and is known to be toxic. As found by Thacker et al. In a 2018 research report, there are also neurofibrillary tangles that are made up of a protein called tau that collect inside these neurons. In a healthy individual, tau normally binds to and stabilizes microtubules to help guide nutrients and molecules from the cell body to the axon and dendrites. However, in Alzheimer's disease, abnormal chemical changes can cause tau to detach from the microtubules and stick to other tau molecules to form what looks like tangles inside of these neurons. The tangles then block the neuron transport system, which harms communication between these neurons.
Hello, my name is Kelly Sloan, and I'm going to be talking about the outcome of this treatment for this patient, as well as the potential for using this low-dose radiation treatment in the future. So the patient received 5 CT scans over the course of her treatment, each providing low-dose radiation. So this treatment was effective for this patient as it was able to slowly recover her cognitive ability. This was observed by improvement in her speech, her memory, and her motor function. The patient was actually able to move out of hospice care, which is end-of-life care, and was placed into a dementia daycare. The fact that she was moved out of hospice care is very important as individuals who are in hospice care rarely get moved out, and it's extremely uncommon for someone with late-stage Alzheimer's like this patient. This dementia daycare allows the patient to have more freedom, and it's going to be more stimulating than the end-of-life hospice care. So the researchers proposed using this low-dose radiation treatment in the future, and they suggest using weekly long-term low-dose fractionated radiotherapy for treatment of Alzheimer's. While we know that radiation does have a carcinogenic effect, there is data that rules out the carcinogenic effect of this low-dose radiation, making it a promising treatment for neurodegenerative diseases. So the patient in question had no apparent risk factors for Alzheimer's other than old age. The patient was 81 years old at the start of treatment and had been experiencing symptoms for about 10 years, making her age of diagnosis about 71 years of age. Other risk factors for Alzheimer's include family history, as well as the presence of the APOE4 allele on chromosome 19. Thank you. This work was informed by Cutler et al. 2016 and Lindsay et al. 2002.
Hi, my name is Diana, and I will be talking about the treatment the patient received. In this specific case study, the patient received radiation-induced treatment, which helped the patient's adaptive protective systems against Alzheimer's disease, which partially restored speech, movement, appetite, cognition, and memory according to the CT scans that were taken. The patient received low doses of ionizing radiation that stimulates a patient's protection systems against disease and age-related deterioration. Radiation treatment looks promising to work for patients with Alzheimer's disease. Radiation has been found to be effective in reducing brain plaques. These specific brain plaques are a protein that is known as beta amyloid, which is accumulated in the brain. And this accumulation is believed to cause cognitive impairments, which would eventually lead to Alzheimer's disease. And researchers do see that the radiation therapy does target to reduce the beta amyloid and slow the progression of Alzheimer's disease while not producing further cognitive deficits.